day and welcome to our very first chat of 2025 on the Red Corner Show. Happy New Year, everyone. As we step into this year, may it be filled with new opportunities, bold dreams, and meaningful connections. Let's continue to amplify voices, share powerful stories, and inspire change together. Thank you for being our first guest of the year, Ms. Clara Moodley. It's an honor to have you on the show. And a little bit about myself. I'm Shamila Ramjawan, a global award-winning entrepreneur, founder of the Princess D Menstrual Cup, Olympus International Awards, and the Red Corner Show. This year, as usual, we will be showcasing people who have made significant contributions in various fields, willing to share their stories. And we are welcome to share our stories as well on the platform, which is a global chat show. So we are thrilled to introduce our very first guest for 2025, Mrs. Clara Moodley from South Africa, currently living in Saudi Arabia. She is a professional nurse leader at the Armed Forces Hospital Taif region, Saudi Arabia. Clara is a transformational leader, an inspired mother who's committed to her family, and she believes in continuous learning with a strong support for diversity, equity, and inclusion. So let's kick off with the show. Welcome, Clara Moodley.
Good afternoon, Shamila. It's indeed a great pleasure to be sharing my journey with you on this incredible platform. It's so great to get your voice out there and share what you've achieved in the hope that others can achieve the same.
Absolutely. And you have...
So to tell you...
Yes, sorry.
A little bit about myself, as you've already introduced. I'm currently working in the Kingdom of Saudi Arabia, but my home is Durban, and I miss South Africa very much. And I have two daughters who are now completed with their college, and my husband that still lives here in South Africa.
Wow, that must be quite difficult with having a split family. So how do you juggle that?
I would not be able to cope without video calls. So thank God for technology. If it wasn't for managing to connect with them on Instagram or Facebook or WhatsApp video calls, it would indeed be very difficult. I don't think I would have coped in a foreign country that's completely different to South Africa if it wasn't for technology.
Absolutely, I so agree with you. And what prompted you to move to Saudi Arabia?
First of all, I'd like to share that, I started my journey as a nurse at the age of 30. So I'd already had a family. I'd had two baby girls, and, I started my career because I was encouraged by my younger brother to start nursing, which was something that I really wanted to do, but I just needed a bit of a kickstart to get there. And starting so late, I knew that there would be a lot of financial responsibilities having two children. And I wanted them to have the best opportunities, the best colleges that I could afford, the best schools. And being a nurse in South Africa, unfortunately, it's not a competitive salary. So I networked with a few of my friends. I discussed the opportunities that there were overseas. And at the time, and till now, KSA, Kingdom of Saudi Arabia, is really investing heavily on their healthcare infrastructure, and the salary is competitive. So that was the pull effect from KSA, and the push effect from South Africa, unfortunately, was the economic instability at the time.
Wow, that is so inspiring for others looking out there and you want to change careers at a later age. Here goes. Clara is a really good example. So take me through being a senior professional leader at the Armed Forces Hospital Taif region in Saudi Arabia. What does your role entail and how has your leadership evolved in this position?
My role as a senior nursing excellence leader is enhancing the quality of the practice of nurses and patient care within my organization, which is a tertiary healthcare facility of more than 400 beds. On a busy day in our emergency room, we would see more than 1,000 patients. It's a pivotal role that promotes evidence-based practice where nurses feel motivated to achieve global standards of care. So additionally, together with my team, we develop and implement policies, quality improvement initiatives, and all of this aligns with the strategic goals of the Armed Forces Hospital in the Taif region. So we also create and update protocols, and we ensure compliance to the regulations. So my key role is to ensure that the team understands effectively what the strategic goals of the organization is, and to follow those goals and ensure that we are achieving it together with a team of 860 nurses.
Wow, that is a lot. I must say that is a lot. So are you in a management role?
Yes, currently I'm in a leadership role, but I have to say that when I started my role in the Kingdom of Saudi Arabia, I accepted a position as a clinical nurse. Coming from a managerial role in South Africa, I accepted a nurse as a position as a clinical nurse because I wanted to learn the system. And my agency advised me, Clara, you're coming from managerial and you will not stay as clinical because they would look at your potential and you will move very quickly from where you are. So I wanted to learn the system and I accepted the position. I stayed in the role for only 3 months when my director of nursing had asked me to assist them in a very busy intensive care unit during COVID. And I was happy to assist because critical care is my specialty. So I'm a critical care specialized nurse. And I assisted them. And soon after, I moved into administration because of my experience in policy creation, policy updates, and policy reviews, because the hospital was transforming at the time from a fully COVID facility to a fully operational community hospital. And they realized that I had experience in auditing and being involved in like accrediting hospitals at the time. So I was moved into administration.
Wow, what a journey. So tell me, so you were in Saudi during COVID?
Yes, I was in Saudi Arabia during COVID in 2021, the second wave of COVID. I worked in an extremely busy emergency department, and it was very challenging because a language barrier. I had to learn Arabic very fast because the patients would speak to you in Arabic expecting you to understand them. So I had to learn very quickly the language, and I had to learn the culture and be able to work in this multicultural, multinational environment during a time where all of us were wearing masks. We could barely recognize each other. The patients couldn't recognize who you were. It was really challenging indeed.
Yes, you know, for some of us that are behind the scenes and we look at the professional healthcare people that work with the full attire, what do you call that?
The hazmat suits
Yes, the
during
hazmat
COVID.
suits. Yes.
Yeah, I
Yes,
have
now
many
that you,
pictures of those.
absolutely. And now that you mentioned, you know, people don't know who's behind or under that suit, right?
Yes.
Um, so that alone is quite challenging. And also leaving your family behind because I'm sure you are really worried about your family back in South Africa.
Absolutely. That was a huge concern because at the beginning of COVID, I was still working in one of our private hospitals in South Africa, and I was very actively involved in opening up some of the extended ICUs during COVID. As you know, most of the patients ended up in intensive care units. So it was very challenging at that time where you would come home, you would strip off all your clothes before you enter the house in a garage or an outhouse because you don't want to contaminate your family. I would sleep alone in the room and not try not to expose them. And thankfully I did not expose my family during that time, because if you're an intensive care nurse, you are on the front line. So yeah, it's I started journaling at that time, so my story is journaled because it was an experience that it's absolutely unforgettable experience.
Wow, that is amazing. So, Clara, I am launching my volume 2 of Watering the Seed, Stories of Personal Growth, and I'd love for you to be an author in the book. And we actually launching the volume 2 edition on the 28th of June this year.
Oh wow, that's awesome. It would be my absolute pleasure.
Awesome. So, as a transformational leader, what are the key leadership values that guide you in a high pressure healthcare environment?
For me, number one is integrity. Communicating and being honest and transparent in your communication is my number one value, because you have to be able to admit when you're wrong and be humble when you're right. And another key value is empathy. You have to understand your team. You have to understand how they are psychologically affected and the psychological needs of your team, as well as the patients. You have to create an environment that is both supportive and safe, as well as being a visionary thinker. The armed forces hospitals, we don't just work in a healthcare facility. I report to the regional director of nursing, who reports to the major general of the military. So it's very complicated. So you have to have that vision of the facility, of the organization. And as a leader, you have to be effective in communicating this vision and this strategic goals to your team so that you're working as a team together towards that goal. So communication or bad communication is the root of most misunderstandings, especially in an environment where you have so many different cultures. My team alone, which is not a very big team, but we spread across the entire facility. I have an Egyptian, I have a Sudanese, I have 3 Saudis, I have a Filipino, and we have South Africans. So you have to be able to ensure that your values are aligned with what they have been raised with. And their values are sometimes not the same as yours because they're raised in completely different environments. And it takes a lot of respect and a lot of patience to understand each other and ensure you're achieving those goals as a team.
Absolutely. So you've got to have patience to work with patients. Wow.
Yes.
So that's quite a mix, this multicultural, diverse team that you have. And I'm sure you
Yes.
have your own set of challenges that go along with that, having to work with people from diverse backgrounds. How do you empower? And I know you touched on it a little bit. How do you empower and motivate your team, especially in this diverse and multicultural healthcare setting?
I think it's so important to foster that environment of inclusivity, to actively promote respect amongst your team, because there's sometimes misunderstandings because of communication. Like, in South Africa, if you would do a simple sign, or in Saudi, if you would go like this, in Saudi, it means give me a minute. And if you do this in South Africa, you'd be very upset because it's sort of sometimes people misunderstand, it's a rude sign, or what are you saying to me? So it's body language that you have to learn and teach each other. We do regular team buildings. We have bonding time during lunch where we will have an Egyptian meal, a Filipino meal, an Indian, South African meal, and we would share, and we would share these our stories of back home. And they are so surprised that I'm an Indian that lives in South Africa, because when my colleagues meet me, they instantly think India because I always wear my dot, and they don't know that I'm Indian but South African. And then I will have to explain that, and then they listen to my accent and that is not an Indian accent. So where is that coming from? So they're very intrigued. And sometimes they do judge you before speaking to you until they really get to know you. So the communication is important, and we also celebrate all the events that they have back home together as a team. So we recognize special occasions that they have to ensure that they understand that we respect them and we appreciate them, and we don't see them as something that's going to hinder our growth. We see something that adds value because they're coming with something different, something we've not experienced.
Yes, I can so relate when you talk about being an Indian in South Africa or from South Africa, because I live in Cambodia. And I get
Yeah.
that as well. When people see me, the first thing they say, "Are you Indian?" Yes, I'm Indian. Where about in India are you from? Then when I say South Africa,
Yes, yes.
oh yes, I know that accent is not Indian accent. You are different.
Absolutely.
So yes, I get that as well, and I think we all South African Indians get that across the globe. So, um, Sarah, just in terms of the challenges that you faced as a South African professional, adapting to a new, different healthcare system, okay? What are some of the changes, coming from South African healthcare and now Saudi Arabia, and how did you overcome them?
When I initially started in Saudi Arabia, as I said previously, that we had to do some updating of policies. And as a South African, we're very strong-minded. When we look at ourselves comparatively to a nurse from the Philippines or a nurse from India, they're a little bit more they're quieter, they will be hesitant to to question something. They're very polite and they're lovely to work, but sometimes they will not question something. But a South African would go straight in and say, compared to this practice that we have done, doesn't seem like something that is up to standard, something that is current, and may I change it? So when I started in my position currently as the Nursing Excellence, one of the leaders, I started in a team that was doing data collection or key performance indicators, all on paper, hard copies, where with 30 different units in the hospital, some units having 10 to 12 indicators and hard copies of sheets of paper submitted monthly. So when I went into the team, I gradually transformed into digital. So what I had to do was I had to get the buy-in of the team. Before getting the buy-in of 800 nurses, we had to get the buy-in of the team and ask them, can we adjust this, and would you mind helping me? So once you have their commitment to help you, you're asking them to join you on this journey, they were very happy to come on board and go through this transition with me. It took us 3 months to transition. And then I had to guide them on how to support the rest of the team in the hospital to learn this new system that I had implemented to save money for the organization. We were saving paper, we were saving ink, we were saving time. So they were very excited about it, and now it's running fully. So we look at things differently. Coming as a South African, I'm so proud of the standards that we come from in South Africa. I had many opportunities to grow in life healthcare, in netcare. These were excellent healthcare institutions, and I'm so proud that I came from a background from there. And when you look at a South African nurse's transcript comparatively to other countries, they would accept a diploma nurse from South Africa where they won't from another country, because our transcript is so in-depth, it's so extensive, and it covers everything that a nurse should know. So we come from a country that has structured the healthcare system so well that other countries like Saudi Arabia really appreciate having a South African nurse.
I so agree with you on that, because I think, we must appreciate the quality of the education in South Africa.
Yes.
And you coming from the medical fraternity, I know what it means, going into another country with South African qualifications, because it adds a lot of value in another country. And if we look at some of the countries and people that come from various parts of the world, if they go to certain countries, they have to start on a very low rank. And that's because of the level of the education. So yes, we are very grateful for being educated in South Africa.
Absolutely.
Yes, and well done on everything you've done and what you've achieved. And going digital, I think that is the way the world is going right now, and you've implemented all of that. So that is amazing. Congratulations to you, and also for you to be given that chance and be given that voice and take over. Not many institutions or organizations will do that. So well done on that, and I'm sure you are just vying for that growth and development every single day. So just being a strong advocate for DEI, diversity, equity, and inclusion, how do you incorporate these principles into your leadership and your daily work?
When I worked in South Africa in the time that I was here, it wasn't a huge focus, the DEI in South Africa. But what I'm so glad in our facility at the moment, we have what is called diversity, equity, and inclusion. We have policies, and directly aligned to this policy, because we have such a huge expat manpower in our organization, directly linked to DEI is civility. So we have appointed civility advocates at our healthcare facility, which is absolutely amazing. Through having civility advocates in our healthcare facility, we now have reduced our turnover rate. Staff they are able to report bullying. They are able to report unfair practices. We as leaders are visible in the hospital. Leadership visibility plays a huge role in diversity, equity, and inclusion in our healthcare facility. And we show support by being visible in the hospital for the staff, for new staff, for existing staff. So diversity, equity, inclusion in a healthcare facility or any organization is so important, to hear the voices of your staff, to hear what upsets them, to hear what burns them out. Sometimes it's the stress of not being able to get along with your colleague that you get increased absenteeism, you get the staff calling in sick all the time. So to implement DEI in such a huge facility and to follow through with having civility advocates makes such a great difference to our manpower in the facility. And as I said, our retention rate of our staff.
Wow, that's amazing. You know, there's so many pluses for you being in a different country and taking on everything that you've learned and experienced over the years and to make a change. You know, that's important, right?
Yes.
I know you touched on some of this, but what are some of the lessons South Africa and Saudi Arabia can learn from each other in terms of DEI in the workplace?
If you're talking about DEI in the workplace, Saudi Arabia is moving into a transition at warp speed at the moment because they are looking at the 2030 vision of Saudi Arabia. One of the greatest changes in terms of DEI is the liberation of their women. They're empowering their women more. We have more female nurse leaders from Saudi Arabia. And part of my responsibility as a leader is to empower those leaders, to ensure that they take up those positions and lead the Saudi nation, because expats are not here to stay forever. The expats are here just to supplement these teams until eventually Saudi leaders take these positions. And in a healthcare facility, there are more women. So they have really given more empowerment to the ladies. But comparatively to South Africa, they need to still do more. They need to do more in terms of empowering the females in Saudi Arabia. South Africa has many women empowerment groups, and they have many committees, and they have many more opportunities than we do here in Saudi Arabia. But at the same time, with DEI and multicultural, Saudi Arabia has certainly moved forward to achieve their goals of 2030. So South Africa can learn about implementing DEI in the workplace, and they can also adopt the practices of having civility advocates that goes with DEI for retention of their teams, for decreasing their turnover rates and things like that. And Saudi Arabia can empower their women more so that they link and collaborate with NGOs so that they can have these committees to empower their community. The community needs more empowerment on DEI. Within our organization, we have DEI is well understood. The community needs more education and training.
Yes, I can understand with the SDGs 2030 goals, a lot of organizations and institutions are now working really hard because we only have 5 years left to make a real impact. And, there was lots of talk and lots of plans, strategic plans, but implementation is key. And that is what we want to see. And we have 5 years to showcase that. What happens in 2030 is going to be very,
yes, 5 years, my goodness. Yes.
Yes. So I like the women empowerment. I'm all for women empowerment, and well done on that. So just going back to leadership as well, and I know you juggle personal and professional lives, being a professional women, and you also have a personal life. You have a family split across oceans. How can professionals, especially women in leadership, prioritize personal growth while managing a career and family responsibilities?
I strongly believe in having a vision. You have to have a plan, and you should not sidetrack your plan to compromise for other reasons. But you can fit in your plan with having a family. What I'm trying to say is, recently, my daughter and I read a book, The Courage to be Disliked. And it's a Japanese phenomenon based on an Adlerian theory that tells you that you should not compromise for other people if you don't have to. it's not saying that be selfish, but it's telling you that you should not say yes for something that you should say no because you are not able to do it. It's a great book, and I advise anyone to go and find this book about the courage to be disliked, because you need to set your goals, you need to know your limitations, and you need to have a clear plan. And I've also read somewhere that when you have knowledge and you empower yourself with knowledge, my children don't remember our home not having books around. There's always books. Their mom was always studying. Because I started so late, I studied every year. I did my 4-year diploma, then I specialized in critical care, and then I did my degree. And my degree and my critical care took me to Saudi Arabia because the doors just opened. And you should be able to gain the knowledge, but don't be selfish with that knowledge, because knowledge is power, but sharing that knowledge and implementing that knowledge is your superpower. So always be able to share, to talk, to empower the community. So you should have goals. You shouldn't compromise those goals. You should be focused. You should be consistent, and you should never drop that ball. You should always ensure that you continue. If you fail, there's no success. Any journey without some failure. Do not be disappointed with failure. Pick yourself up and continue. Never ever quit.
Love it. Love it. What a bundle of inspirational words. And so we've come to the end of the show. Is there anything that you would like to add?
I'd just like to say thank you so much for this opportunity. And I hope that, I can inspire at least one person with this interview. And I'm sure you've inspired many as you've inspired me. And I hope that somebody somewhere would listen to this and they would continue with their goals. If they felt like they were about to quit, you will pick yourself up and start again, and you will continue, and you will have hope, and you always have support. So I hope that more women will be empowered, and more women will take up leadership positions, and they will be brave to stand up and speak for themselves and speak for the others and empower the communities as well. And our little girls are watching us. They're not watching what we say or listening to what we say. They're watching what we do, and they're drawing inspiration from that.
Wow. Wow, wow, wow. Clara, I am so happy to have you on the show. As we wrap up this inspiring conversation, I want to extend my heartfelt gratitude to you for sharing your wisdom, your passion, and your journey with us today. Your story is a testament to the power of resilience, purpose, and making a difference. And this is what we want on the show. We want to showcase this to our audience, and we want to inspire other people as well. So, to our audience, thank you for tuning in and for your support and for being a part of the Red Corner Show community. May this year be filled with growth, new opportunities, and impactful moments for each of you. Until next time, keep shining, keep striving, and remember, your voice has the power to create change. And if you would like to be on the Red Corner Show, please drop me an email, redcornershow@gmail.com. And we too can be chatting like Clara Moodley. Clara, thank you so much. And I wish you all the best. Safe travels back to Saudi Arabia. And I hope that I could meet you someday.
Me too, I hope so. Thank you so much.
Thank you. Take care. Bye, everyone.